Quiver Full Ministry welcomes you to Fertility Conference 2022. Ladies and gentlemen, Dr. Oluseye Arikawe. Dr. Oluseye Arikawe is a medical doctor with nearly 30 years of experience. She's a general practitioner with special interest in women's health, diabetes, lifestyle medicine, and medical education. She's passionate about helping women connect the facts of medical science to the truths of God's words. She has a blog called A Word for Her, www.wordforher.com, where she writes regularly on issues relating to women's health and faith. She's also a columnist for UK's only Christian women's magazine, Women Alive. Her new ebook, How to Make Menopause a Positive Experience, was released on the 31st of October 2021. It's available on Amazon and most digital stores. She lives in the UK with her husband and daughter. Ladies and gentlemen, please welcome to the Fertility Conference 2022, Dr. Oluseye Arikawe.
Good morning, good afternoon, good evening, wherever you are connecting with us today. I would like to say thank you to Sister Nika Bagu and the entire Quiver Full Ministries for organizing this amazing conference. Yes, so my sermon this morning is to talk to us about the role of science and faith in infertility, what my experiences are around this area, and what couples can do. So firstly, I'm going to lay some foundations by giving us a definition. So when we talk about infertility, we actually referring to subfertility, and that's the inability of a couple to achieve a pregnancy after having regular, unprotected sexual intercourse about 3 times a week for a period of 12 months. If after that time and a couple has not been able to achieve pregnancy, we usually advise that they go for a medical check. So I'm going to pause for some time and to say, if there's someone here on this call or you're going to listen to this later and you fall into the category I've just mentioned, may I ask us to kindly go and get tested, go and have medical checkup just in case we haven't. I know there are people that have actually gone to have the checks, but there are some people that haven't. So we just said after trying for 12 months, we want to encourage you to go and have some medical checks. So let's say we're going to have those medical checks. What are the kind of things that we can find out when we go for the checks? So sometimes you've gone and done all the tests, they've checked the man, they've checked the woman, and they can't find anything. Sometimes we say it's unexplained, and actually in 25% of cases it's unexplained. And there may be someone on this call that fall into that category. May I just say to you, saying unexplained doesn't mean there is nothing that can be done. We know that with God, all things are possible. And there are options. There are options for every single one. For every category that we're going to mention today, there are options. And we're going to talk about these options later on. So yes, you've gone for those checks. What are the kind of things they can find out? I'm going to start by talking about male factors, and that's deliberate. So deliberately, I'm going to start with the male. And also, may I also say that we want to encourage the men to please go with the woman for those checks. Sometimes women are willing, but the man is not. So in my practice, actually, if someone comes to us that they're trying to achieve pregnancy, we usually ask them to bring their husband and bring their partner because we need to send them for those tests first. So we check the man first before we start to send the woman for some tests. So let's say we've done the checks for the man. What are the kind of things they can find out? So one of the common ones that we know that people talk about is, they said he has low sperm count. So low sperm count is referred to as oligospermia. So that's when the quantity of the sperm that they find in the semen is far below the normal. Sometimes we could have what we call azoospermia. That's when they can't find any sperm in the semen at all. And that could be as a result of obstruction. So sometimes going for those checks just mean they would be able to do maybe simple procedure to relieve the obstruction, and then we'll repeat the test, and then we'll find out that yes, there are actually, enough quantity of sperm in that semen. And there are times that maybe they're enough, they can see the sperm in the semen, but the numbers of the abnormal forms is far above the normal. So sometimes there could be defects. The sperm is made of the head and the tail. So sometimes there could be defect, especially the defect of the head of the sperm. And that's important because we need the head of the sperm to be able to penetrate the egg for it to form the embryo. So yes, so apart from problems with the sperm, there are other issues that we can find out that could be related to the men. One of these could be as a result of ejaculation problems. We have premature ejaculation, delayed ejaculation, or what we call retrograde ejaculation. That's when the semen is actually traveling backwards. Sometimes it travels backwards and then it's passed out in the urine. And that's not going to lead to, it's going to be difficult to achieve pregnancy if that's a problem. But there are options available. There are treatment options available for all of this. And that's also the importance of actually going to get all those tests done so that whatever the options there are, we'll be able to take the offer. So there are other issues that could be connected, that could be male factor issue. Some men may have, difficulties, maybe it could be psychological, it could be stress related, or it could be as a result of certain medications. Some antihypertensive can actually affect a man. It can cause problem with ejaculation. It can cause problem with the erection. Sometimes some conditions, medical conditions, a very common one is diabetes. Some men with diabetes could have problem with erection, but there are options. There are medications that can be given to such people. If it's as a result of the medications they are taking, there is a side effect, we can change those medications to something else. And there are some men that just have no interest in sex. Yes, believe me, I know people think, oh no, men always, they love that. But there are some men that it could be as a result of some psychological issues or some physical problems. There's a condition called hypogonadism. And that's when the male sex hormone is deficient. And such men may have loss of what we call loss of libido. They've got no interest at all. Again, this can be treated. Maybe they need to have hormone replacement. So it's important that we just go and get tests so that we can know what options are available for us and can get them checked and get the treatment that we need. So I'm going to go on and talk about some of the female factors. So what could be responsible for a woman not being able to achieve pregnancy? And this could be as a result of maybe problems with the tubes. Sometimes they say there is blocked tubes, which could be from previous infection. There are times that we don't even know why. I've had women said, I've never had an infection before. I don't know why, but I've gone to do the test. They said, my tubes are blocked. I had a friend that they told her the tubes are blocked. At the same site, both tubes are blocked. Imagine that. She's never had infection before, never been pregnant before. There are some things you may not be able to explain medically, but that's when we can then start to apply our faith. Psalm 18, 44 says, foreigners submit to me. As soon as they help me, they obey me. They submit to me and come frightened of their hideouts. Whatever foreign thing that may be blocking those tubes, we can command them to come. But for instance, if you haven't actually gone to do the checks and you're trying to pray, you don't know what you're praying for. But for that, my friend, we eventually did IVF, and it was the first attempt, and she got pregnant. That baby today is going to secondary school. God is amazing. God is amazing. So there are options available. Option available was a supernatural. It was God's intervention. The option they gave to her is IVF, and we went for it by faith. And today we have a lovely girl. Like I said to you, she's going to secondary school this September by the grace of God. So other factors that can be responsible for a woman not being able to achieve pregnancy, apart from the tubes, there could be problem with ovulation. There's a condition known as polycystic ovarian syndrome, where a woman may not get regular periods. Maybe some women have period like twice a year. Some maybe every couple of months. But again, these are things that they could give you some medications to stimulate the ovaries to produce the eggs. And sometimes a woman may have some medical conditions like problem with their thyroid that could affect them from having ovulation. And then there's a condition again where we used to say premature menopause, but it's, primary ovarian insufficiency. Menopause is when women, when they get to certain age, they stop producing eggs. But there are some younger women believe me or not, maybe they're still less than 40s, and for some reason they stop producing, they stop ovulating, and they go into what we call premature menopause. Again, we said there are options available. He said, I'm the Lord, I change not. Is anything too difficult for me? Even if there's anybody here today, you're younger than 40 and you're already, seeing signs that you stop having period or you're going into premature menopause, God can step in, and there are options. We're going to talk about the options that, that doesn't mean because of that you will not be able to, carry your own pregnancy or have your own children. But we just need to talk about the things available for us and for us to go and take up all those options available. Again, there are other issues that could be responsible for a woman. It could be problem with the womb itself because the baby needs to implant in the womb. Some women have congenital issues with their womb, that maybe the womb is formed in such a way that it's difficult for the baby to implant. Again, fibroids, which I know most of us are aware, this is so common in our community. Fibroids some women have fibroids that they're so huge that they've taken over the entire womb where the baby is meant to stay. Again, we have options available for fibroids. There are lots of treatments now. There are medical treatments. Not all fibroids will require surgical intervention. There are lots of options that could be available for a woman who has fibroids. It does not mean that because you have fibroids, you can't carry your pregnancy to term. We've had testimonies of women, lots and lots of testimonies of women that they said, oh yeah, it's fibroids, but it doesn't mean that you still can achieve pregnancy. But we are saying that all those things I mentioned about what could be responsible is helping us to, when we now want to stand in faith, when we now want to pray, we know what the issues are. We are not in the dark. We are not ignorant. We are not ignorant of what the problems could be. There are other issues. Some women, maybe chromosomal issues that they're not even aware of. They were born with it. So it's until we've actually gone on to go and have those medical checks that we know exactly what's going on. And another very common reason could be what we call advancing age. Science tells us that when a woman gets a certain age, then it becomes impossible or it becomes difficult to achieve pregnancy. But may I just encourage us, the Bible says, you renew our youth like the eagle. Sarah is a very popular example in the Bible of a woman who actually achieved pregnancy after she's past the age. Sarah was already menopausal, well past menopause, and she gave birth to that promised child, Isaac. So if there's anybody here and people talk about, biological clock is ticking, that's man, that's science, Yes, but God is still able. We've known so many women in their 50s that when God steps in, it doesn't matter how old you are, God is still able to turn things around. So those are the things that could happen. Those are some of the things. There's so many other reasons why we couldn't conceive. But I've just mentioned some of the common ones that could be responsible. And I don't want anyone here today to feel, does that mean that I have all these issues? Does that mean that then maybe I cannot achieve pregnancy? One again that people don't really know about is endometriosis. It's another condition which it's quite difficult to diagnose because it takes a long time before we get that diagnosed. Most women would have suffered lots of period pain, severe pain, heavy period, or pain all over the place. Endometriosis is a condition in which the lining of the womb, rather than being lined where it's meant to be, when it starts to grow in other parts of our body, like the ovaries or the fallopian tubes, and it could actually lead to issues, when it starts to grow on the ovaries and start to form deposit, it can cause scar tissues forming. And it's one of the major reasons why women will not be able to achieve pregnancy. Again, treatment can be offered for this condition. And once it's been diagnosed, then we can go on and get all those treatment that we need for them. So I've spoken to us about some of the things that could happen. Those are the facts. That's what science said. But where does our faith come into play? For every of these conditions I've mentioned, there's a word in the Bible, there's a scripture that you can actually use to stand on to pray. But if we don't know what those things are, how do we then, apply those Bible verses to those conditions? So I think it's very important for us today that it's not just for us to come and, hear all the facts, all the options, but it's important for us to say, what actions are we going to take? What actions are we good? I can share so many examples of women that by the grace of God, they've actually, maybe taking the advice of let me go and get tested. I could remember a lovely sister who went on to have all the checks and they gave her the option of IVF. And this sister came to me and burst into tears and said, God has failed me. They've asked me to do IVF. I don't know how many people think that doing IVF means God has failed. But I would define IVF for us. I know science says assisted conception. My definition of IVF is God assisting man. Something that you've tried naturally, and you've not been able to achieve pregnancy. Imagine now that you now go on to have in vitro fertilization. That means it would have to be a supernatural hand of God. It takes a miracle for IVF. There are lots of people that have tried IVF. Some have tried several times, but they've not been able to achieve pregnancy. And we know people that have tried their first attempt. But the story of this sister that I was saying to you, after a long time of convincing her to actually go by faith and do the IVF, do you know she actually started the process? Before they actually could do the IVF, she fell pregnant. That baby, that lovely boy is 4 years old now. So it takes God. It takes us actually not just saying, oh, I don't want to help God. You're not helping God by doing IVF. I think going for IVF is actually God helping us. So we say we are standing in faith, but I believe you cannot stand in faith without you knowing the fact. And for our faith to work, we need to apply. We need to apply, we need to do something. If you look in the Bible, there's so many instances of God doing miracles. And all the miracles, something has to be done. Remember, Naaman had to actually go and wash. Naaman was told, you need to go and wash in the pool Siloam before he was healed of his leprosy. The woman that was told, you need to go and borrow a vessel, borrow not a few. Let's imagine Jesus himself, the very first miracle Jesus did. The mother of Jesus said to them, whatever it tells you to do, do it. So that means for somebody here today that you're trusting God, maybe you've been trying and then they've given us all these diagnoses and we're saying we're trusting God, we're standing in faith. But maybe God is saying to us today, you need to take action. You need to take action. And so that's what I'm going to say to us. God is telling us to take action. And that action could be go and try for IVF. And I don't want anybody to feel, somebody said to me, I'm going to share my testimony if I do IVF. Some people don't want to say that was IVF baby. Why not? We should proudly say it because it's actually supernatural, So somebody said, that sister has been trying for a long time. She's now pregnant. And the first they said that, was it natural? I really don't understand what they meant by that. What do you mean was it natural? I think we should say to them, no, it's not, but it's supernatural. If your baby is IVL, let people know. Proudly stand on that altar to share that testimony of the supernatural hand of God. I was saying to someone that most of us Christians, let's say for instance, you have a burst appendix. Are we going to go to the hospital to have that surgery to remove that burst appendix? Of course we would. So what difference? What's the difference to that? So why can't we go on and do IVF? Or, it's not just IVF. There are lots of other, there's so many options. I know we have another doctor on this call today who's going to go into details to tell us all the different options available. Intrauterine insemination, intracytoplasmic sperm injection. There's so many options they would offer to us, but most of us faith mamas have not actually gone to find out. Some of these things, like the example of my sister that I shared, all she did was just to go and start the process. Before they actually could do it, she got pregnant. So God is waiting on us while we say we're waiting on God. God is waiting on us to go and take that step and do that thing. Just like that woman, she had to go and borrow a vessel, not a few. Until we've actually taken that step. And I want us to remember what Mary said to them. He said to them, whatever I say to you, do it. So what's God saying to us, faith mamas, as we stand in faith, trusting God for the fruit of the womb? What has God said? We need to not just saying, we are standing in faith. We need a revelation. We need a rhema. We need something that we can run with. So if God is saying to you, do IVF, and it's not just IVF, it may be God saying to you, go and adopt. I've had lots of beautiful testimony stories of adoption. There might be a child there waiting for us. There might be twins there, triplets, waiting for us to come and adopt them. And we are saying, oh no, I'm standing in faith, I'm trusting God. And God is saying, I want you to go and do that. I've known people that have gone to do adoption, and after adoption, they've had children again. Some have gone to do IVF, they now have children that they're now saying to me, you know what can I do for contraception? I'm like, what an irony, Somebody you've been trusting, praying to God for them to get pregnant. Now, they've done IVF maybe the first time, they have the baby, and now they have 2, 3, 4, 5 after, and they now thinking of doing, using contraception so that they don't have more than they can cope with. So I'm just going to say to us that there's we're going to hear a lot of information today, but I want to encourage us. We need to do something with that information. We need to run with that information. We need to take action. What action are you going to take today? You've been trusting God for a while. What action are you going to take? Yes, I know, like I said, all the faith mamas, there are a lot of scriptures. I've sent a link to Sister Nika. I'm sure they're probably going to put it in the chat. To my website, I have a printable of scriptures that women can use to pray when they're trusting God for the fruit of the womb. I have posts on my site for women before you try for that pregnancy, even when you're pregnant. And I talked about the place of faith. But yes, there is a place of faith, but doesn't mean that science doesn't have its place. Both works hand in hand. When you have the fact, it's important to know the fact. I believe that you need the facts for your faith to work. For you to put your faith into action, you need to know what the facts are. So I want to encourage us, the sisters here, the brothers here, and especially the men. Please stand with us. Because I know I have friends that they want to do IVF, but their husbands are against it. How do you do that? So I want to encourage everyone. It's not a sin to do IVF. God hasn't failed you when you go for assisted conception. There's nothing wrong in adoption. There's nothing wrong in surrogacy. They're all options. And God is saying to you today, what are you going to do? God is waiting on us. I think we should stop waiting on God now. Now it's time for us to take action. So I'm just going to leave us with Hebrews 11:11. It says that for Sarah received strength to conceive when she was past the age. I know there might be people here, maybe you're already in your 50s and you're still trusting God. The Bible says that Sarah received strength. So I want you to receive strength today. I want you to receive strength. And that strength may be that maybe God is saying to you, go and adopt. Go and, maybe there are other options that God is saying. Maybe you need to receive that strength. Sarah received strength to conceive when she was past the age because she judged him faithful who had promised. It takes faith for whatever assisted conception you'll be offered. It takes faith for it to work. So receive strength. Take the options, do something. I want us to take action today. Do something. Go on and do what the Lord is saying to you to do. As we stand on the word of promises, then we need to then do something about the word we are standing on. And I know the Lord would hear us speedily. God is faithful. God is faithful. I'm trusting the Lord that next year conference, there'll be lots of testimonies of women who have actually gone to get checks and they found out that it's a simple procedure that can be fixed. Or maybe they've said, let's go and do assisted conception, and now they have their babies and they will proudly share their testimonies. So I just want to encourage us. The Lord would help us and the Lord would grant each and every one of us our heart desire. Thank you. God bless you.
I'd like to throw this question to Dr. Oluseye Arikawe. One, I want to ask about, she can address the cost as well. And also, I wanted her to address the fibroid, because we've had several questions around fibroid. And I remember in her presentation, she spoke about the challenge of fibroid and how you might need to remove, when to remove, if you need to remove fibroid. So I'd like Dr. Oluseye to address the fibroid question as well. Somebody's asking, what of the situation where a spouse is not comfortable with donor eggs for IVF? What do one do? I think that the Dr. Emeka has answered that question. If the spouse is not comfortable with this counseling, so I think that question has been answered. I wanted for financial perspective, let's have the UK perspective from Dr. Oluseye, and I'd like her to address the fibroid, how to deal with cases of fibroid. I'm trying to see, there's another question. Okay, so there's no more question, but I'll ask another person. Dr. Arikawe, please, can you take the question, please?
Hello, everyone. Can you hear me?
Yes, I can. Yes, we can hear you.
All right. Thank you again for having me here today. So I'm just going to answer the question concerning IVF treatment from the UK perspective. In the UK, if you're below the ages of 42, you can actually access IVF free. And that's if you haven't actually had a child before. But what we find that especially people in our community, because we take a long time to go and get tested, by the time some of our sisters have actually gone to have the medical checks, they're already over that age when they can actually get a free IVF under the NHS. So in case, I know that people are watching globally, in case you're in the UK and you're watching this program, and you're trying for the fruit of the womb, from everything we've said about options, about actually going to find out, I think it would be nice. I mean, if you can get it free, why do you want to pay? I mean, well, I say free in the sense that you've been paying your taxes, and so we have free NHS treatment. I'm sure somebody in Nigeria will be saying, I wish I could get that, because I know IVF is not cheap. It's very expensive. But if you're below 40 or you're below 42, you may still be able to get free IVF. So it might be a good opportunity to actually go and see your GP, the general practitioner, and they will be able to refer you to the clinic to get free treatment. Then the next question on fibroids. Fibroids, yes, fibroid is that thing that most people from my community, there are lots of us that we've had issues with fibroid. It's so common. It's something that is more common in Afro-Caribbeans. And, fibroid starts small. I mean, I can share my experience with fibroid. The first time I was told, they said it was a seedling. It will start as a really small thing, and then it starts to grow. Again, when it's really small, it's a lot easier to do the surgery and get it removed. I know somebody else again mentioned about when Pastor Nika was sharing the testimony of the woman that the fibroids were growing. It's better to get the surgery done when they're still really small. Sometimes when you have very huge fibroids, some women, they've been told that the fibroid has taken over the whole womb. They might not be able to take out the fibroid. They might need to take out the whole womb, which is not something we want for someone that is trying for the fruit of the womb. But as we've said, there are lots of options. It's not all the time that you need to have surgery for fibroids. There are lots of other treatment opportunities that you can have now. You can have medications to shrink the fibroid. You could have some injection that they do into the arteries to sort of kill the fibroid from growing. There are also some other medical treatment. I don't know if they are available everywhere. Even in the UK, you may not be able to find some of this treatment. It's called a focused ultrasound, where they would use an MRI focus ultrasound to sort of, focus it on the fibroid, to shrink the fibroid or to stop the fibroid from growing. So there are lots of available opportunities that can be done for people with fibroids. And again, we've mentioned about options. If you have huge fibroids, or maybe you've had lots of surgical procedures on your womb, and that's led to a sister that shared a testimony on surrogacy, if they cause damages to the womb, there are other options. You may want to go for surrogacy, you may want to go for adoption. But I think the first thing to say is that we need to go and actually have the investigations done first. And then if they offered surgery to us, I think Pastor Nika shared that as well. I don't want us to say, I don't want to do surgery. I just want to keep praying and standing in faith. We've said there is a place to pray. Yes, you can pray and then go on and have the surgery to remove the fibroid when they are still really small, before they become too big, that it becomes too complicated or technical procedure to do. I hope that answered somebody's the question.
Thank you so much. Yes, that answers.